I'm pleased to report that our National Emergency Medical Service has improved considerably over the past few years in both the public health system and the private sector with respect to the network of vehicles, the management structure, and the number and quality of trained personnel providing the services on a daily basis. In the public sector, the acquisition of more ambulances and trained emergency medical technicians, EMTs, as well as the launch of our 811 Easy Access number have resulted in a substantial increase in the use of the service and the number of emergency calls from an initial 42,000 in 2005 to 65,511 in the period of October 2008 to September 2009, which accounts for a 56% increase. In fiscal 2008-2009, emergency calls received reached an average of 5,459 per month and 179 per day. One standard we'll be using as a gauge for providing a high level of emergency health care is the ambulance to population ratio. The optimal ambulance to population ratio for a country like ours is 1 ambulance to 25,000 persons. Today, with the addition of these new ambulances to the fleet, we are on par. Ladies and gentlemen, in terms of our ambulances, we have reached first world status in terms of the ratio. In terms of our regulation, we are there. So we are making those steps and we are moving there and getting there. Currently, we have 37 serviceable ambulances. Today, this number is being increased to 52 ambulances operating from 13 bases. The addition of the 15 units to the current fleet will increase the number of ambulances now available to the national population for emergency health care by 40%. It is also important to note that the ambulance response time is 39 minutes, 59 seconds for 95% of emergency calls. In fact, the ambulance response time for many emergency calls actually falls within 15 minutes. So therefore, as we commence 2010, let us resolve that we will all take ownership, create the efficiencies, ensure kindness and caring in healthcare delivery, and let us take it to a higher level. I call on all healthcare workers and professionals to continue the good work, and let us lift the bar with a level of caring and professionalism as we attend to patients. Ladies and gentlemen, it is my pleasure to celebrate with you the addition of these 15 new ambulances to our emergency response fleet. And I do look forward to the achievement of even more milestones in 2010 as we inch closer to attaining our national vision for health. Thank you. Best wishes to all for a bright, prosperous, and may all citizens have a year full of good health. I thank you very much.